Good evening, ladies and gentlemen. Welcome to Triple N Talk Show. I am Dr. Nik Nikam, and this is Wednesday, February 10, 2016. We have a very important topic today, which we're going to be talking about sudden death. It's not the most pleasing topic that you want to hear, but if it can make a difference in the life of one of your family members, or if it can make a difference in the life of one of your co-workers or relatives, that's all the difference that counts. You're watching the Triple N Talk Show, which is coming to you live on YouTube and also on Google+. While we are talking about YouTube, before that, we would like you to download our app, which is NNN Media. We're on your smartphones like Android or Apple devices, and also your smart tablets. So you can watch this interview coming to you live on YouTube. And while we are talking about YouTube, we would like you to please do subscribe to our YouTube channel, which is Nik Nikam, where we have more than 800 subscribers and more than 800 videos accenting the days of our lives, and more than 800 views, close to 750 views on our YouTube. We would also like you to visit our Nik Nikam Network Facebook page and like it, where we keep you abreast of what's happening in and around town and from around the world. You are watching Nik Nikam Network Talk Show. I am Dr. Nik Nikam, and let us begin with the most important topic for today, that is sudden death. What got me interested in talking about this topic of sudden death is two of my colleagues with whom I had worked for many years were victims of sudden death. One of them had a massive bleeding, and a second one just very recently had a massive heart attack, cardiac arrest, unsuccessful cardiopulmonary resuscitation, and a person who was there a few hours before is no longer there. So we're going to explore what are the causes of sudden death, how do people with sudden death present, what are the manifestations? How can we identify people who are most likely to be candidates for sudden death? And how can we take action before they reach a point of no return? Before a point where no cardiopulmonary resuscitation or any medical measure can save their lives. So stay tuned. It is an important topic because it can save the life of a family member or a friend or a relative. Sudden death is not an uncommon feature. It happens every day all across the globe. And there are certain conditions which predispose to sudden death. We're going to talk about them in depth, and the major focus of this presentation is to educate you as to what are the symptoms that will trigger in your mind, well, we need to seek immediate medical attention. When you seek immediate medical attention, the chances are much better in saving that person's life and their whole family, the grief of having lost a loved one. So what are the most important causes of sudden death? Cardiovascular problems, heart and the blood vessels related problems are the most common causes of sudden death. We are going to look at individual conditions that lead to sudden death and how we can identify and hopefully prevent, even if it's in a very small number of patients. If it happens to be one of your family members, that is all the difference that it can make in your life and in your family's life. Then we are also going to look at the lungs, conditions which can cause sudden death, and this cerebrovascular accidents or the brain circulation and anything related to the brain that can cause sudden death, and how do we identify some of the premonitory symptoms. And finally, we will look at some rare conditions. You know, you have seen athletes dropping dead on basketball field or a football field. What's happening to them? Why did they die suddenly? We're going to explore some of those different options. So let us begin with the most common causes of sudden death, beginning with the heart. I am a cardiologist. I've been practicing cardiology for 35 plus years, and I have come across people who have died suddenly, and it is very important for us to understand what leads to sudden death in cardiac patients. When we are talking about cardiac patients, first we need to talk about the heart itself. Then we're going to talk about the blood vessels, conditions which can lead to sudden death. As far as the heart is concerned, the two most important causes of sudden death are a massive heart attack and irregular heart rhythms. Sometimes they can be both interrelated, and I will explain to you how. Let me see if I can get that slide here to show you about the heart conditions that lead to sudden death. Okay, here. The arteries supplying the heart muscle provide oxygen to the heart muscle and keeps the heart muscle alive. If there is a plaque buildup in the artery supplying the heart muscle, and if it completely occludes the artery, there is no circulation to the heart muscle beyond the blockage. And this dark area represents a heart attack. Imagine if the artery is blocked off right at its origin, a massive amount of heart, 30–40% of the heart muscle may not get adequate blood supply, and that can lead to massive myocardial infarction or a massive heart attack. And when patients get massive heart attack, they lose the pumping efficiency of the heart. As a result, there is reduced circulation not only to the heart blood vessels themselves, but also to the brain, and that can lead to irregular heart rhythm, which makes the patient collapse. They are in cardiac arrest. The EMT comes and they try to resuscitate. But it is important for us to understand, when there is reduced circulation to the brain for more than 3 to 4 minutes, there is permanent brain damage. You heard about people in vegetative states who are lying in the hospital. Their heart is working, their lungs are working, their kidneys are pumping urine, but their brain is not functioning. So in cardiac arrest, the most important thing that we can do is to identify candidates who are at risk for cardiac arrest. It is from the heart attack point of view. There are approximately 600,000 people who have heart attacks, and more than half of these people drop dead. Let me repeat again what I said. There are more than 600 heart attacks that happen in each year in the United States, and almost 360 cardiac arrests happen, mostly outside the hospital, in a home environment, workplace, or in a shopping mall. And majority of them don't make it even to the hospital. And those who make it to the hospital have a better chance of survival, and those who are identified before they have a heart attack or a cardiac arrest have the best chance of survival. That's what I am going to be focusing on. So when a patient comes with a cardiac arrest, of course, you see the emergency team arrives, they do the cardiopulmonary resuscitation, chest compressions, breathing, and checking for pulse. This is known as the basic life support or advanced cardiac support, life support, and we transport them to the hospital. We can diagnose a heart attack based on the electrocardiogram if they still have a rhythm. But if they are in cardiac arrest, chances are they are in a what is we call as ventricular fibrillation or ventricular tachycardia, and everything depends upon time and the extent of the myocardial damage. So if you have a heart condition, if you already had a heart attack, then you need a regular medical checkup, because the coronary artery disease, that is the blockage of the arteries in the heart, is a progressive disease. Even though you had bypass surgery, even though you had a stent, that doesn't mean that your heart disease is cured. The most important thing for you to keep in mind is it is a progressive disease. That's why you need regular checkups, regular exercise tests at certain intervals, so that we can identify one progression of disease or development of disease in the arteries that have been bypassed or arteries which had coronary stents. And if we can recognize these critical lesions in these arteries, and if you do an angiogram and fix these blockages with a balloon or a stent, then maybe we can prevent a massive heart attack and thus hopefully prevent a sudden cardiac death. So that's one of the mechanisms by which a massive heart attack, by losing the pumping efficiency of the blood and also getting into irregular heart rhythm, can cause sudden death. The second type of cardiac problem that we encounter is known as cardiac arrhythmia, irregular heart rhythm. Most of us have what is known as the sinus rhythm or regular rhythm. The regular heart rate is between 60 to 100 per minute. But sometimes your heart, instead of pumping from the upper chambers, instead of the pumping action starting from the upper chambers and going into the ventricles, sometimes these ventricles may start acting out. And this is more common in patients who have had multiple heart attacks, who have severe congestive heart failure. And you might have heard those people with low heart function or the low ventricular ejection fraction in the range of 30% or less. And you also might have heard these are the people who may have what is called the defibrillators. Why do they have defibrillators? These defibrillators are pacemakers which shock the heart. If they go into ventricular fibrillation, is placed there to prevent sudden cardiac death. So these are some of the reasons why it is so important for you to get a regular medical checkup. If you have hypertension, if you have diabetes, if you have heart disease, if you have bypass coronary artery stents or congestive heart failure, you need to be on a regular checkup to make sure these conditions are detected before they become a terminal event in anyone's life. The defibrillators are supposed to go off when they go into what we call ventricular fibrillation or a ventricular tachycardia that cannot sustain blood pressure. When the ventricular tachycardia cannot sustain blood pressure, there is lack of circulation to the brain, there is lack of circulation to the heart muscle itself. As a result, the arrhythmia gets worse and the patient collapses. That's when you see people doing cardiopulmonary resuscitation, and majority of the time, if you don't have adequate medical facilities that the ambulances have, the cardiopulmonary resuscitation may not be successful. Excuse me. Okay, let's talk for a moment about cardiac arrest and death in young people on basketball field, baseball field, or football field. What's going on with them? What's wrong with their heart? Why didn't anybody detect this beforehand? How can a 20-year-old young basketball athlete drop dead on a court? How is it possible? Let me explain to you. Okay, if we look at here, this is a normal heart structure. The left side is thicker than the right side, and it's about 1 centimeter thick, the muscle. Whereas if you look at here, the thickness could be anywhere from 1.5 to 2 centimeters. When the heart muscle is thickened, it is called as hypertrophic cardiomyopathy. It just simply means thickened heart muscle. Why should a thickened heart muscle be of concern? Well, here are some reasons. When the heart muscle, it went back. When the heart muscle is really thick, and when it squeezes in this area, then it prevents the blood from going from the ventricle into the aorta. So when there is reduced circulation, I already told you that reduces the circulation to the heart muscle itself and reduces the circulation to the brain. when there's reduction of circulation to the heart muscle, that can trigger irregular heart rhythms. And that could be one of the causes of people passing out. And if this lasts for more than a few minutes, that can lead to permanent brain damage, and the ventricular fibrillation may lead to permanent cardiac arrest. And those are some of the explanations for patients with hypertrophic cardiomyopathy. Not everybody has hypertrophic cardiomyopathy, but some people can have the more serious cardiac arrhythmias, what are called as ventricular tachycardia. These are irregular heart rhythms arising from these abnormal heart muscles, which trigger these irregular rapid heartbeats. When they trigger these irregular rapid heartbeats, it may not be able to sustain blood pressure, especially when you're exerting yourself, when there is so much adrenaline pumped into your system. When your heart rate increases, the blood output from the heart chamber decreases. And in a patient who already has a mechanical or a functional narrowing of the outflow tract, everything gets worse with exercise. That's why you see people drop dead when they are exercising vigorously, if they have what is known as the hypertrophic cardiomyopathy. So from my point of view, as a cardiologist, having practiced for more than 35 years, I would say every athlete who is involved in a competitive sport, every athlete who is involved in a vigorous activities, and even those people who are jogging should have a complete cardiovascular evaluation. An ultrasound is a non-invasive test which takes less than 5 minutes to diagnose if someone has hypertrophic cardiomyopathy. And if we have that, the chances are we would be able to save your life, which is more important than dropping dead on a basketball field. So that's one condition that we need to identify. And that's why I would even recommend this to high school students who are involved in competitive sports to get a cardiovascular examination, especially if you're having chest pain, especially if you're having dizziness or lightheadedness with exercise. That may suggest a drop in blood pressure. That is not a very good sign. So these symptoms should trigger and get preliminary checkup. If everything turns out good, that's good and well. But if there's a problem, then we need to address it, because staying alive is more important than getting any scholarship for a college or a university. Let's move on to another condition that can cause sudden death. You heard of blood clots in the legs, known as DVT. I'm sure you've seen some commercials on the television, treatment for DVT with blood thinners. What is DVT? That is deep vein thrombosis. Thrombosis is a fancy medical term for clot formation within the veins in the legs. Why do clots form in the legs? Well, there are conditions which predispose to clot formation. Obesity is one condition. Reduced activity is another condition. And prolonged bed rest and various conditions can lead to stagnation of blood in the veins that can cause blood clot formation. But this blood clot formation, when it progresses, can become bigger and bigger, and eventually it can go into the lungs and block the major arteries going into the lungs. That is from the right side of the heart. When, for example, I have to go, let's see if we can go back to the next previous one. Or like here, this is the venous system. When a blood clot migrates from the lower end of the body and it comes up here, it can go into the right atrium, right ventricle, and into the pulmonary artery. And if a major blood clot blocks this pulmonary artery, there is no circulation going to the lungs. So somewhere along this circulatory circuit, the blood supply is stopped. When that happens, patients can collapse. And if there is a massive pulmonary embolus, okay, stay there. Oh, cable problems today. All right, I think we are back in business here. Let's see. Okay, if there is a massive pulmonary blood embolus or a blood clot blocking the main branch coming from the right ventricle or one of the major branches, then that can drastically reduce cardiac circulation and lead to cardiac collapse, cardiovascular collapse. And when there's collapse, there's not enough blood pressure. When there's not enough blood pressure to the heart muscle itself, that can go into cardiac arrhythmia, the most dangerous of which are ventricular tachycardia and ventricular fibrillation. And here, let's see, there's a CAT scan here. I should have. Okay, here is a CAT scan showing pulmonary artery, which is sort of upside down, but you see the filling defect here? The filling defect is a hallmark of a blood clot. If someone has a massive blood clot in the main arteries, as I said, the blood circulation will be cut off, and that reduces the circulation and patients collapse. How can we identify these patients who have a tendency for blood clot formation? As I told you, if someone has a history of deep venous thrombosis or DVT, they need to be on blood thinners. And usually we recommend them for 3 to 6 months, but if they have a propensity to develop blood clots again and again, some of these patients may have to be on blood thinners lifelong. And if somebody has large blood clots, sometimes we put what is known as a filter. Let me go back here again, if I can find that picture again. Okay, yeah. Here in the inferior vena cava, we put like a basket to prevent these major clots from reaching the heart. By putting a basket in this major vein known as the inferior vena cava, we can prevent major clots from causing a massive pulmonary embolus. So what are the symptoms of a massive pulmonary embolus? Chest pain, shortness of breath, rapid heartbeat, sweating, weakness, dizziness, and collapse. If someone is experiencing these symptoms, you need to call 911. What did I say? You need to call 911 because they need to seek immediate medical attention. If the clots are huge, we may not be able to do anything because it is too difficult to get these clots out of the main arteries. But if the clots are not that big, they need to be on intravenous blood thinners and later on switch over to oral anticoagulants like warfarin or any other type of blood thinners so that we prevent them from getting these major blood clots. So pulmonary embolus is another important condition that can lead to collapse and sudden death if it's massive. But there are usually premonitory symptoms or pre-existing conditions like deep venous thrombosis or DVT or a history of pulmonary embolus. These are the patients. They need to be followed on a regular basis, and we need to look for evidence of recurrence of blood clots so that they are on a long-term blood thinners. And another important thing I want to stress about blood clots is inactivity. A perfect example is if you are traveling across the continents, 16-hour, 20-hour flights, and if you have a history of heart failure, if you have a history of deep venous thrombosis, you definitely need to see your specialist before you get on the plane, because 20 hours of inactivity can lead to more blood clot formations. And I have seen people who have traveled cross country come back with massive leg swelling from clots totally blocking the main veins in the leg. So by taking precaution, we can prevent certain conditions that can lead to cardiac collapse, cardiovascular collapse, and sudden death. And when you travel, if you are on prolonged inactivity, you need to take a complete examination and any recommendations from your doctor to make sure that your blood thinning medications are optimized and you do some leg exercises while you're sitting in your place that will keep the blood pumping back to the heart while you're waiting to finish that 16 or 20-hour air travel. And you may also use elastic stockings that may also help to prevent the legs from getting massive swelling during a prolonged flight. So that's as far as the pulmonary clots are concerned, which is known as pulmonary embolus, or most commonly known as PE. And if you are just having these major symptoms and you don't have a cardiac collapse, and if you come to the emergency room, it takes less than 15 minutes to do a cardiovascular CT angiography and detect these blood clots in the pulmonary arteries, veins, arteries, and then we start immediate treatment. Hopefully, we can prevent any further clot formation and allow time for these clots to dissolve so that we can save your life. Let's change the topic, and as you're seeing here, this particular thing represents one of the books which I have released just recently. It is called Nik's Comedy Clips. A little shift from what the topic I am talking about. This is available on Amazon.com, and it's only $3.99 for Kindle version, which you can download and read at your leisure, or you can get a printed copy, which is $12.99. And when you do buy a copy of this book, please do leave some comments on Amazon.com about how this book made a difference for you. So that is just a little shift in the topic. Let's get back to the topic, which is really hot and important one, because if it can save the life of one individual in your family, somebody you love, or a family member, or a neighbor, or a co-worker at workplace, that can make a huge difference. And that's like the biggest service you can do to humanity. Okay, let us shift gears and look at another condition that can cause cardiac collapse and sudden death, and that is stroke. I'm talking about massive stroke. Minor strokes and even major strokes may not cause a cardiac collapse and cardiac arrest or things like that. About 800,000 people develop stroke each year, out of which 130,000 people die. And most of the time, if they die within 24 hours after the onset of stroke, it is considered a sudden death. But the most important thing is there are certain conditions which predispose to stroke, and we should be aware of those conditions and monitor them very carefully. And most importantly, if someone has some symptoms of what may suggest like a stroke, the time is of the essence. The faster you get to the emergency room, the quicker they diagnose the existence of a stroke, and the quicker they start the treatment, there's a much better chance of not only surviving a stroke, but also minimizing the damage caused by stroke. There are two different ways in which people can get stroke. Let's look at that. Okay, here is a picture. The most common form of stroke is what is called a blockage of an artery. Just like in a heart, where people get blockage in the arteries with a clot formation that reduces total circulation to a segment of the heart muscle, and that causes stroke. Similarly, blockage of an artery that is supplying one region of the heart muscle can cut off the circulation to that particular region of the brain, and that can lead to a stroke. If a major artery is blocked off, then you can get a massive stroke. When you get a massive stroke, a few things happen. The major segment of the brain is damaged. Along with that, there is brain swelling. And when there is brain swelling, it pushes the rest of the brain through the brain cavity, which is fixed. And all of these can lead to coma and also interference with autonomic nervous functions, namely breathing, heart rate, blood pressure. And all these are controlled by brain. But when the brain itself can't function, and all these functions are going to be impaired, that's what leads to a major multi-system problem. Breathing problems for which they have to be intubated. Their blood pressure may drop, for which they have to be on massive doses of blood pressure medications to just support the blood pressure. And reduced circulation can lead to irregular heart rhythms or cardiac arrhythmias. So all of these can compound, and that's how that can lead to a sudden death in a patient with a massive stroke. That is from a clot. The more dangerous one, and about 87% of the strokes that happen are related to clot. Where does this clot come from? Okay, let's talk about clot. The major culprit for clot that causes stroke is heart. So it's coming back to the heart again. What are the most common causes that cause clot formation in the heart? Irregular heart rhythms. The most common of which is atrial fibrillation. So if you have atrial fibrillation, chances are you should be on blood thinners. Especially if you have chronic atrial fibrillation, enlargement of the heart, congestive heart failure, then you should be more likely to be on blood thinners to prevent clot formation. Why? Because you don't get a clot going to your brain and end up with a massive stroke. That's not good. So you need to be on blood thinners. You need to be closely followed by your cardiologist and also neurologist if you had a previous history of stroke. People who have a previous history of stroke are 3 times more likely to get a subsequent stroke as compared to the normal population. That means you should be 3 times more cautious or 10 times more cautious about getting supervision from the experts, from cardiologists, from neurologists. Follow up and make sure that you are on the optimal medical treatment. And the second and the more dangerous form is like a bleeding in the brain, bleeding inside the brain. How do people get bleeding inside the brain? Sometimes they have what is called as AV malformations. This is like a congenital malformation or the arteries inside the brain. When these arteries are deformed and their walls are thin, and when they rupture, there's pumping of blood through this, even a tiny artery. And since the brain is in a skull, in a very tight, closed cavity, any small amount of bleeding can put a lot of pressure on the surrounding brain tissue, and that can lead to a massive stroke. You have heard about people who fall down and get what is called as a subarachnoid hemorrhage. That is a bleeding inside the skull, but on top of the brain, in the space between the brain and the skull. And in those cases, you heard people have to go for emergency neurosurgery, where they have to drill a hole here in the skull and release the pressure. But we are talking about massive stroke happening from bleeding inside the brain tissue itself. When they get massive bleeding inside the brain tissue, that's not a very good sign. But when it happens, if they are on blood thinners, this is one of the problems, the most dangerous complication related to people who are on blood thinners to prevent the stroke. It doesn't happen every day, but those people who are on blood thinners may be at a very minuscule risk of getting a massive intracerebral bleeding. But we have to weigh the advantages versus the disadvantages of being on blood thinners. But when this happens, if they are on blood thinners, we have to reverse the blood thinning effect. And more importantly, I think it is important to diagnose what the problem is. And if there's a pressure, it can be relieved, the pressure. If we can relieve the pressure, that is something we need to focus upon. So what are the symptoms that can trigger you to say, hey, this person needs to be in the emergency room right now? Okay, let's go back to some of the symptoms. Okay, here, stroke prevention and treatment. It's called the FAST, F-A-S-T, fast track. The fast track doesn't begin in the hospital. The fast track begins at your home. When somebody collapses and when somebody has a facial droop, where the face, one part of the face is drooping, that may be a sign of a stroke. Or if one of their arms or the legs are hanging and they are not able to lift it, that may be a sign of a stroke. Hey, what happened to this? Okay, if they have a slurred speech, like this, that may be a sign of a stroke. You need to be in the hospital immediately. Why? If they can diagnose a blood clot blocking an artery, and it takes no more than 20 minutes to do an angiography of the brain with a CT scan. And if you recognize a blood clot blocking an artery, you can be treated with blood thinners, intravenous blood thinners that can dissolve the clot and hopefully minimize the stroke and also save your life. So that's why it is very important to remember facial droop, arms or legs having weakness, slurred speech. It's time to call 911. Seek medical attention as quickly as possible, because time is life when it comes to stroke. If you get into the medical facility, if they can diagnose and start a blood thinner in the case of a clot within 90 minutes, the chances of reducing the stroke are much greater than if you were to appear, okay, you have some symptoms in the morning, okay, I'm going to be there in the afternoon because I got an important business to take care of. That's not going to cut it. So if you are having symptoms, or if one of your colleagues at workplace are having symptoms, call 911, because that can save the life of that individual. That can save the grief of that family having to endure a patient with a stroke. So these are some of the things that cause a stroke. Let me make sure I have covered all the aspects. There's one more condition that I would like to cover in the next few minutes, and that is known as the aortic dissection. When I started off, I said most of the causes of sudden death are related to cardiovascular problems. That is the heart rhythm, heart thickness, and now we're going to talk about the main blood vessel that is coming off the left side of the heart, namely the aorta. Aorta is a thick wall blood vessel. Let's look at a picture of that. Okay, where is it? Okay, here. Excuse me, ladies and gentlemen. Aorta is a major artery arising from the left side of the heart that gives major branches and goes down into the abdomen and supplies the rest of the body. But there are certain people who are at a major risk of developing aortic dissection. Aortic dissection simply means the splitting of the wall. Oh, where did you go? Splitting of the wall of the aorta. As you can see here, the aorta is normal, but the wall itself is split into two. And generally, there is a tear that leads to splitting, because when there's a small tear, then the blood from the inside the aorta gets into this second chamber, and it gets bigger and bigger and bigger. So it eventually blocks this circulation. Eventually, it blocks the circulation to the main arteries and also to the blood vessels supplying the heart. When this happens, I told you there is drop in blood pressure, drop in circulation to the heart that can lead to collapse, irregular heart rhythms, and maybe sudden death. Aortic dissection is characterized as various types, and Dr. DeBakey from Methodist, the medical center, was a pioneer in identifying this aortic dissection and categorizing them as DeBakey class 1, 2, 3. The most important thing is like a tearing pain in the chest. sweating, weakness, shortness of breath, collapse. When somebody has these symptoms, we need to get to the emergency room, because here, with a CT scan of the chest, we can immediately diagnose the aortic dissection. We can identify the location of the dissection, the type of aortic dissection, and what needs to be done. And if time permits, they need to be live flighted to the best medical facility, like the medical center, where they can manage these patients with a major cardiovascular surgery and hopefully save their lives. It's one of the most catastrophic conditions if an aortic dissection progresses to a point where it blocks the circulation to all the major organs of the body. So this is not a very common condition, but who are the people who are most prone for aortic dissection? People with long-standing severe hypertension, people with history of weak aorta, namely patients with Marfan's syndrome. These are the people who have like long arms, long fingers, long legs. They have a condition where their aortic walls are weak and they don't have the elastic nature that most people have. As a result of a thin wall or weakness in the wall, they can get a tear inside the wall, tear inside the artery, that can lead to aortic dissection. And if that's the case, again, time is of the essence. We covered a lot of conditions that can lead to cardiac arrest. But most importantly, the thing that we really need to focus on is to make sure that we identify the symptoms and get these people to medical facility as soon as possible before these symptoms get worse and before they reach a point of no return. Ladies and gentlemen, we are talking about sudden cardiac death, and it is important for us to recognize some of these symptoms because it could save the life of someone you love, a family member, or your neighbor, or one of your co-workers. Thank you so much for watching, and we'll be back again next week at 6 p.m. You've been watching the Triple N Talk Show. I am Dr. Nik Nikam, and have a wonderful evening.